If he wants to speak, he can, but I don't think it's complicated enough to.
And Doctor, if you would please stand up. You traveled, you might as well get some exercise.
Yes.
I will ask the obvious question. I presume in getting your doctorate, you've probably taken a number of tests that probably are comparable to what effectively is being tested of other folks that don't have doctorates in audiology or board certified ENTs. I'm presuming you've probably taken those tests in some nature.
Yes, sir.
Okay. Yes, sir.
I just quit. I'm totally supportive of
Yeah,
it, but I'm just trying to. So, the language says audiologist licensed to practice in Virginia, who have earned a doctoral degree in audiology shall not be required to pass an examination as a prerequisite to obtaining a license under this chapter. What other license would they be already licensed for in Virginia to be an audiologist to qualify for this?
Licensing requirement
I see.
for audiologists.
Separate from what they're trying
Yes,
to get.
so what you're dealing
Okay.
with the situation here is there's a licensed audiologist, and then there is the process to be licensed to sell hearing aids.
I got
So
you.
you.
It makes sense now. Thank you.
This is more allowing them to fit and to sell hearing aids.
Great.
It's in line 42 of the bill. It's really, yes, sir. Elder Blaine.
Mr. Chairman, a friendly question to the bill. Is there a need for continuing ongoing education that as technology changes with hearing aid technology, that someone who earned a doctorate degree at one point, is that already part of their licensure, that they're getting continuing education would be up to speed with new types of hearing aids that maybe is coming out in 15
Very
years?
good question.
Absolutely.
Is that a freshman question?
Yeah.
That was-
Wow.
Yeah, it was a good one.
Wow.
Hey.
Wow.
Around a few weeks now, everybody.
Yes, sir. And I think Delegate, the answer was in the affirmative.
Yes.
Response.
Yes.
All right.
Thank
Anyone in
you.
the audience? Thank you, sir. Thank you very much for being here.
I have a motion.
Go ahead, just real quick. Is there anyone in the audience to speak in favor? Otherwise, that feels compelled to speak. Anyone to speak in opposition? All right, Delegate Dees.
I'll move that we recommend reporting Senate Bill 315.
Second.
Probably moved and seconded. Senate Bill 315 before us is to be reported. Members will vote on the electronic voting record.
We were being
Measure
entertained.
advance on 10-0. Senator Rupp, you do not need to be at full age, don't you? If it goes south, I'll find you before it goes farther south.
Okay, thank you.
You know what I was trying to, I'm sure this is already licensed. Why didn't he even
Senator Parker.
Yes.
Super license.
I had some.
So, draw the committee's attention to Senate Bill 762. 762. Good afternoon, sir. If you
Thank
could
you
let us
very
know
much.
why we need your bill and what it does.
Yes, what it does is it includes behavior analysts, which is a license category established in 2012. A lot of what they do relates to individuals with somewhere on the autism spectrum and various things. In the definition of licensed mental health professional. What this does is directs the State Board of Behavioral Health and Developmental Services to amend regulations so that they are classified as a licensed mental health professional, which does affect some of the types of things they would be doing in concert with other licensed mental health professionals.
All right, sir. Members have a
So it's a Section 1 bill, so.
All right. Matt, why don't you stand up and tell us, because this committee's sort of job, we hear lots of scope of practice and people
Right.
want to be licensed, want to be certified. I always tell them, beware what you ask for, you might get it. It's really nice to be able to bill for your services, but that puts a whole lot of encumbrances. If you could tell us very briefly what behavioral analysts do versus licensed clinical psychologists and practitioners that you and I were talking about earlier.
Sure, Mr.
Very
Chairman,
briefly.
members of the committee, Matthew Stanley representing Virginia Association for Behavior Analysis. Licensed behavior analysts are one of the categories of mental health professionals in the Commonwealth that are providing behavioral health services. And right now there's a long waiting list for behavior plan development. So this is adding them into the licensed mental
I know
health.
the bill, that's what, excuse me for interrupting, sir.
Sure.
I apologize humbly. Tell us what they do, though.
What do behavior analysts do specifically?
Yes, sir.
They help write behavior plans. They work with individuals needing to adjust their behavior. These are often services for children and individuals with autism.
All right, so just for the members, and Matt, if I misspeak, so these folks, just so you know, these folks like will go into your classroom and observe a child and how he's interacting in the environment and with the other folks, and if he's acting out or misbehaving and so forth. They might go into some other settings as opposed to a patient would come to their office like a clinical practitioner, clinical psychologist, and so forth. And if I'm misspeaking, you all please humbly correct me and so forth.
Sure, and
so they want to be now considered under this concept, under the definition of a licensed mental health.
Sure, that's correct, Mr. Chairman. I do have Chrissy Evanko here. She's the administrative director with the association. I'll also just say that DVHDS is currently doing some fast track regulations right now with their human rights regs that actually address this more specifically, and we're asking for this bill to make it comprehensive within the DVHDS system that licensed behavior analysts are recognized as a licensed mental health professional alongside those other 6 professions that are also providing behavioral health services.
Another bill I'm sure we'll be hearing next year, so Alexa wanted you to know what these folks do. Yes, sir.
Just a question. I think by gaining this recognition, aren't you also then able to access federal dollars, state dollars through the plan, through Medicaid or others?
That's not a ramification that we've really explored or dealt with.
Okay.
And they
For
are already,
reimbursement or-
yeah, part of what happened was that, you know, we put in requirements, regarding coverage of people on the autism spectrum. Started out with a mandated benefit that went up to age 7 and then keeps getting expanded, and I think this year may end up being comprehensive. So we've already done that type of thing. One of the concerns that people had initially was that, well, these people who are providing these services, how do we know that they're certified, that they really are up to snuff? We established this category in 2012 to address that issue, but what we didn't do was then put it in the other code sections that identified who were licensed mental health professionals. So we created a new licensed mental health professional category. It was the first time it had been licensed in Virginia for behavior analysts, but we did not plug in all the other places. And what this does is to ask the department, to direct the department through regulation to go back and put it in wherever it would be appropriate.
So, and David and Dr. Brown, just make sure I'm correct. Currently, they come under the regulations of DVHDS. They now subsequently become under licensure of the Board of Medicine.
Mr. Chairman, David Brown, Director of the Department of Health Professions. Behavior analysts are already licensed
Right.
by our department.
Right.
And what he's referring to is this would clarify, in my understanding, in behavioral health regulations that they could be considered along with psychologists
Right.
and other people as licensed mental health professionals
Right.
for the purposes of those
Yes,
regs.
sir. All right. Thank you. Thank you very much. Anyone in the audience to speak in opposition to Senate Bill 762? All right.
Move to pull, Mr. Chairman.
Second.
Probably move to second that Senate Bill 762 be reported. Everyone's ready to vote? You'll cast your votes. That very good advance on 10-0. Senator, you do not need to be at full HWI. If you go south, I'll prevent it from going too far south without.
Before I get to Tennessee, you'll let me know.
Yes, sir.
All right, thank you.
Senator McClellan, I apologize
Kentucky.
for keeping you waiting.
That's okay.
All right, draw the committee's attention to Senate Bill 293.
Thank you.
If you could tell us why we need your bill and what it does. please.
Sure. Well, first I'll tell you what it does, and then I'll tell you why. Senate Bill 293 authorizes the Board of Pharmacy to issue a limited license at a reduced fee to a prescriber at a nonprofit facility to dispense contraception and drugs for the treatment of sexually transmitted diseases. The reason for this bill is that in many of these clinics, your doctors already have, actually any doctor today, we have a model in place where a doctor who is prescribing a drug can get a license to dispense that drug on site, but the doctor is the only dispenser or prescriber who has the ability to dispense. This follows that same model, but in a more limited way, in a nonprofit setting, only for contraception and STD drugs. And the reason for that is particularly for low-income individuals, it is an added barrier to them actually taking these drugs if they have to first go to one clinic, get their prescription, and then go take a separate trip to go to a pharmacy to get them filled. And so this is a very limited process in place to remove that barrier to them taking these drugs. And in particular, studies have shown that and we know that if you're not taking, first of all, with the contraception, if you're not taking it, you're going to have an unintended pregnancy. If you are taking it, you're much less likely to have that. For the STD drugs, if you're not taking them, you're not going to treat the disease. So this is in a very limited way removing that extra barrier following a model we already have in place.
All right. Questions,
it is controlled substances and devices for contraception or treatment of sexually transmitted diseases.
But there isn't like a list of the things that go along with that.
No, but if you want one, I can put one in. But I think
No,
the Board of Pharmacy is going to have regulations in place that will list what those specific drugs
Because I was
are,
just
and it gives
wondering, 'cause I
them
know
the
that,
right.
Mr. Chairman, I know that we're very sensitive to pain medications, and I didn't know, like, I've never had an STD, but I just like,
Transparency Caucus member. Transparency Caucus member. Too much information.
But my question, are we talking antibiotics? Are
It's
we talking
basically,
about?
it's
Okay.
basically antibiotics,
Okay.
but the Board of Pharmacy and their regulations will list out what those drugs are.
So, but before we go there, so
I'm gonna have to
Caroline, so,
abstain.
so,
Advocated by the FDA.
tell us what this actually is, and she has the answer to your question, Dr. Weiss, I'm sure.
Sure, Mr. Chairman, Caroline Duran, Executive Director for the Board of Pharmacy. So just a slight correction, the Board of Pharmacy probably would not enumerate the actual drugs in regulation, but rely on FDA indication. So those drugs that have been FDA approved for the purpose of treating a particular STD or as an approved contraception would be captured in this allowance.
So, Caroline, to that point though, if a person came in, particularly a man, because it tends to be painful when they get, say, chlamydia or gonorrhea, they have a painful discharge. If they came in with pain.
Parliamentary inquiry.
If they came in, but to Delegate Price's point, if they came in with pain, my inference of this language is they're able to dispense controlled substances, including Schedule 2, which would be, or Schedule 3, which are pain medications and so forth, and devices for contraception or treatment. Would that be a reasonable interpretation? Because that's what I got from counsel, but that's okay.
And I'm not counsel, and so I almost hesitate to answer the question. However, I that might be a little stretch for the Board of Pharmacy's interpretation. I foresee the Board of Pharmacy interpreting antibiotics for the treatment of STDs. The pain would be perhaps a separate condition. I hear what you're saying with respect to the fact that it would be pain as a result primarily from a primary diagnosis of the STD, but I don't
Pain
believe
pills
this
would be
was
considered part of a
envisioned.
treatment of any medical condition. If you got pain, you give pain pills, okay.
Okay.
If I may, just to
Our
follow.
resident pharmacist.
But to follow up on that, the DEA would also have to, the physician also would need a license from the DEA to be able to dispense those
Correct.
as well, which I highly doubt they would have.
Good point.
Well, but this is being, any prescriber, it's gonna, this is actually granting a limited license to the facility where a prescriber is already working. That prescriber would have a DEA license that mine allows me to Schedule 2 through 6 or whatever.
To prescribe and not dispense. So the DEA would actually have a license to prescribe and then a license to dispense. So I find it highly unlikely the prescriber would have a license to dispense Schedule 2s, 3s, or 4s.
Okay.
But, you know, and if I may have a follow-up question,
Yes,
Mr. Chairman,
sir.
on the fee, what would a reduced fee be? I mean, that could be.
Spoken from a person who has to pay the whole fee.
Yeah, have to pay the whole fee, and which I have some questions. So what would?
So that would be enumerated in the regulation by the Board of Pharmacy. There is precedence already established for physicians who are sole practitioners. We already offer a reduced fee. If you are a physician who's a sole practitioner, I would think that we would look to that model as some precedence in trying to establish this reduced fee.
Okay, follow up, Mr.
Dr.
Chairman.
Hodges, yes, sir.
And if I may, the fees and the license fees cover Board of Pharmacy to run itself, basically. We don't subsidize, the General Assembly doesn't subsidize, we depend on those fees to pay.
That's
So
correct.
if there's a complaint or if there are any problems or so forth, those fees have to cover those costs.
Yes.
Okay.
Further questions of the patron?
I have a motion.
Just a second. Anyone in the audience to speak in favor of Senate Bill 293?
The administration supports this bill.
All right. Anybody else in favor? All right. Anyone in the audience to speak in opposition to Senate Bill 293? Yes, sir. Come on forward.
Bill Janis, Family Foundation. So, Mr. Chairman, what you have here is a bill, we're speaking in opposition to it, that doesn't define this limited license. It doesn't define the scope and parameters of what the requirements will be to comply with the license. Leaves it to the Board of Pharmacy to come up with these regulations within 280 days. As Delegate Hodges already pointed out, there are costs for compliance with these regulations. Okay? The premise of the bill is that you're gonna give an entity that doesn't have the ability to dispense these today, the ability to dispense them in the future under some limited license that's undefined in the legislation. It'll be determined by the board. You're gonna waive their fees. The compliance costs are borne by the fees. The board, as Delegate Hodges also pointed out, the Board of Pharmacy is basically funded by the fees that come out of pharmacists like Delegate Hodges and others who pay the full fee. There is precedent for sole practitioners, but these are physicians that are being given a provision to be a dispenser for these and on a reduced fee schedule. What you're doing is you're basically carving out a group of folks that are 501c3s. I'm assuming one of those 501c3s is Planned Parenthood of Virginia. But let's look at Planned Parenthood of Virginia. It's a 501c3, it's a nonprofit. 37% of their operating budget last year nationally, their total revenue, 37% of it came from taxpayer dollars. Last year, nearly $544 million from taxpayers to that nonprofit, right? So this is basically going to subsidize, directly or indirectly, Planned Parenthood of Virginia to dispense these pharmaceuticals, you know, and what you're going to do is you're going to have some kind of regulations that they're going to have to comply with. Board of Pharmacy is going to have some requirement to ensure compliance. Board of Pharmacy is going to have to respond to complaints when there is non-compliance or when there's a problem or when someone presents and has Schedule 2s or Schedule 3s, you know, provided to them. And because the Board of Pharmacy isn't going to promulgate a schedule, but they're just going to say, well, what this schedule is what the FDA says it is. You're going to have some of these facilities that are going to be dispensing drugs that go beyond the scope of practice that's contemplated by this legislation. There are going to be complaints. There are going to be problems. The Board of Pharmacy is going to have to go and investigate them, and they're going to have to bear the cost and expense of it. And they're not the ones that are going to bear the cost and expense of it. Every pharmacist in the Commonwealth of Virginia who has to pay the full fee for licensure and be subject to the same kind of, and be subject to more stringent compliance costs and regulations is going to have to bear the cost and expense of those compliance fees. So for those reasons, we oppose the bill.
Yes, sir. Come on forward.
Mr. Chairman, Bill Ray with the Virginia Catholic Conference. We also oppose this bill. I just want to echo the comments made by the Family Foundation.
All right, sir. Anyone else? No? All right.
Yes,
Senator.
and if I may, first of all, just
Please.
to correct what Mr. Janice said, it does not waive the fee. It tells the board to have a reduced fee, and those fees are going to be set at a rate that is commensurate to recover their costs. But when you don't have a full-blown pharmacy on site, when you are only dispensing a limited number of drugs, you don't need the full range of the full-blown pharmacy license, and the work of the Board of Pharmacy is going to be less.
And John, I want to make sure that I understand what you just said. Do you all already, are your fees already more than commensurate to cover your costs? Do your fees, are they profit centers for the
Well,
department?
I'm not saying they're going to profit. I'm saying it's going to recover their costs.
No, code would require us to cover our costs. If we
Currently.
have excess, we have to give back by reducing our fees.
So if you have a reduced fee, presumably that's not going to cover your costs. If your costs are being covered by the full fee.
Not
then you have a
necessarily.
reduced- Okay.
It would have to be, the entire revenue budget would have to be taken into consideration, not just this one licensing category.
Okay. Sorry, Senator. I'm sorry. Didn't mean to interrupt.
But I think my point is that when the board sets what the fee is going to be, they're going to look at what activities are we going to need in this limited circumstance to regulate, and they're going to set fees based on that.
All right. Did you had a motion? All right. One last question.
Just had a question to that. I mean, you mentioned that it's a limited license at a reduced fee, but then when you look at 24 and 25, it says shall be exempt from fees associated with obtaining and renewing such permit. So then, in one point, you say it's reduced, and then you're saying it's exempt on the last line. So what is that?
That's the permit is different from the pharmacy license. So what that is, and maybe you might want, yeah.
So you have the license, and then you have the limited use permit as well. So I mean, which I see. So you're saying you have a reduced fee on one, and then you're exempting the fees on the other.
Different.
We license the individual prescriber,
Right.
and I believe the reduced fee would apply to the individual's license.
Correct.
And then the facility permit fee would be waived.
Right. Which is what I'm.
All right.
Mr. Chairman.
Delegate Hodges. All right, Delegate Hodges.
Did you
I'm
want
done.
You're done. So we have a particular bill before us that deals with the pharmacy issues that have been discussed. I defer to Mr. Hodges on his I'd like to ask the chairman, though, in terms of the big picture of what the House is trying to do regarding the issues that the senators raised, which is fewer unintended pregnancies, which lead to fewer abortions, which is something I know we care about, as well as addressing sexually transmitted disease. Everybody cares about it. I gotta speak to that. I gotta speak to that.
Okay.
So, right. So, and then also on Charnel's bill, which we did in House HWA.
Right.
Can you tell us about what we're doing in the budget on those two
yeah, sure.
points?
So two of the areas, and Senator, I don't know what y'all have in the Senate because I haven't had enough time to sort of look at all that. I think y'all had funding for the long-acting
Yes.
reversibles. We have funding for long-acting reversible subcuticular implants. So we've got that in both budgets. So there will be an expansion of the access to contraceptives available in the clinic settings, at the very least, with the Department of Health, sort of statewide. And then Delegate Herring had a bill for expedited partner therapy, which is going to address some of the concerns that you've raised and that your constituents have raised as well. So may not be completely there, but I think we are making steps there. So
Thank you,
Mr.
Mr.
Yeah, Delegate Price.
I would add though that was for prescribing, this is for dispensing, so it seems like this would make it
Absolutely.
even more comprehensive.
I would agree
And
with you,
at the
yes.
proper time, I do have a motion.
Yes, ma'am.
Move to report.
All right, probably moved and seconded that Senate Bill 293 be reported. Yes. All right, members ready to vote on that? Okay. So cast their vote on the electronic board. And that fails to report on a 4-6 vote.
Thank you. This was a much more lively hearing, even if it wasn't as.
So, Senator, you will find, and I will say this quite sincerely, and I say this as sincerely, and I ain't got to blow smoke up anybody. I'm a trauma surgeon. I operate on 13,000 people's lives. I ain't got to blow smoke up anybody. I am very deeply appreciative of this committee. Every member on here has made a real impact on all Virginians, and I'm not blowing smoke. I say that sincerely, and we're blessed because you all do speak your minds, and you all do engage in this process. And I know that for a fact, Senator. I can speak for each one of the 9 of these others because I've spoken to them all individually about a variety of different issues. So, this what you saw was how these folks. That's how they roll. That is how they roll. So, yeah, absolutely. All right. Have we got any? I think members. Draw the committees. Hang with me for a second, members. I think these are all the bills that have been assigned to our subcommittee number 1. I think the Uber chair is planning to have a meeting on Thursday. Tomorrow we're done. As his final meeting. So, Delegate Delaney, you will find the House of Delegates will come to almost a screeching halt after tomorrow. You'll have plenty of time on your. I would encourage you to, those areas that you have subject matter expertise and interests in our space in HWI. You'll have 2 weeks to get to know Dr. Brown and Caroline and all these other advocates out here, Mr. Janice and the Catholic Council and blah blah blah. All right. With that, we are adjourned. Thank you very much, committee. I appreciate it. So those 3 bills will go to Bobby.
They're on the docket. Yes.
All right.
Yours, any pictures of your police tomorrow, the subcommittee will be on about point.
Are you, sir?
I'm good.
We are,
Good.
done tomorrow.
All right. Oh,
Okay, 4 bills.
All right. Thank you.
Thank you. Thank you, brother. Okay, absolutely. Thank you.
Thank you for your leadership. Thank you. I really enjoyed being on this committee. Thank you. I know you don't.
Sounds good, I'll be around.
Thank you. I really appreciated the experience.
Everybody told me I did well because I didn't do that.
Yeah.
Your license is
Hi, how are you?
Looks like David
It was priceless. It was MasterCard priceless.
I started this job in 2000.
I didn't think we were going there, did we?
Thank you.
Okay, okay.
Church.